My mother was not expendable. My mother is not a data statistic. My mother was loved.
Ana Celia Martinez was born in Puerto Rico and settled in Brooklyn, becoming a seamstress to support her daughters. She was only meant to spend a short time in a West Islip rehab center for a leg abscess.
She kept telling us she had a fever, but they kept telling us it was low grade.
Martinez's daughters became alarmed when a doctor called about respiratory issues.
He said, oh, well, we can send her home in an oxygen tank.
Ana Celia Martinez died 2 days later. The death certificate listed coronavirus as the contributing factor. Daniel Alvino, a well-known football referee who fought in the Vietnam War, was in the same facility after neck surgery.
They said that he was well enough to come home. Buried in the paperwork, it said he was running fevers and he was a quote-unquote COVID suspect. So they suspected he had it. They didn't test him, they didn't treat him, and they didn't tell us. And they sent him home to us in horrible condition.
Alvino passed away in mid-April. His wife took the malaria drug when the rest of the family came down with COVID-19.
His life was just snatched from him, and it's just not right.
The family started a Facebook group, Voices for Seniors, to air their grievances. The governor had warned nursing homes could not exist in a bubble, especially with staff commuting in and out every day, and with the possibility of caretakers being carriers.
One ember finds its way in, and then it is fire through dry grass.
The State Department of Health told Pix 11 News it's opened more than 2,700 investigations based on complaints about nursing homes during the pandemic.
It's a breeding ground for germs, just like if you go to a doctor's office.
Bronx Senator Gustavo Rivera chairs the Committee on Health.
There's been failures at the national level, at the state level, and at the city level.
And do you think there's been a failure concerning nursing homes?
That's what we need to get to the bottom of, but it seems likely.
Jeffrey Weber's mother, Winifred, died in the Long Island rehab.
I don't think that there was proper isolation.
We asked Senator Rivera about a little-known section of the new state budget that gave nursing homes protection from lawsuits.
I would certainly love to know when exactly this provision was inserted.
Stephen Hand speaks for more than 400 facilities in the state.
As we know, this is a highly contagious virus. It gets in very, very easily. In a nursing home or an assisted living facility, you cannot practice social distancing. Care needs to be provided at the bedside.
Nursing homes are scrambling now to satisfy a mandate that they test more than 200,000 employees statewide twice a week for COVID-19 infection. Workers also demanding more hazard pay and effective protective gear that they say wasn't provided early in the pandemic.
Management was not coming on the unit without proper equipment. They were fully geared while we were without proper equipment.
Certified nursing assistant Alexis Lewis earns just under $18 an hour caring for COVID patients. The aides at Linden Nursing Center recently received a bonus.
If you work for 2 weeks straight, you would get $250.
But Nurse Burnett, a union rep, said the homes will have to do better.
Give us proper equipment, give us hazard pay, give us incentive to come to work.
The incentives will need to be there with a potential second wave of COVID-19 predicted in the fall. Infection control now monitored so closely by the state health department that nursing homes will have to do FaceTime tours of their facilities to show how they're fighting germs. I'm Mary Murphy, Pix 11 News.